Hilda Hayo, and I'm the CEO and the Chief Admiral Nurse of Dementia UK. I came to the charity in September 2013. I've been a nurse for 42 years, and my passion for dementia care came about after my first placement as a student nurse, where the care was less than satisfactory for people living with dementia, and I vowed that I would do something about that. Today I'm going to explain what Dementia UK does. I'm going to outline our 2020 and 25 strategy, and I'm going to share progress on the strategy to date and our plans for the future. We're an unusual charity because we have two brands. We have Admiral Nursing, which are specialist dementia nurses, and we also have Dementia UK, which is the charity that hosts and supports Admiral nurses and Admiral nursing development. We're a specialist clinical charity that supports the specialist dementia nurses, and the way we do that is by developing Admiral nurse posts, which are either fully funded in local services, part funded, and often the part funding comes from a strategic plan that is partly funded by Dementia UK, and also fully funded posts with Dementia UK. All Admiral nurses are continually supported by Dementia UK, whether or not they're funded by Dementia UK or other organisations. And we do that to make sure that our Admiral nurses have the same competencies in the Isle of Wight as they would do if they were working in Scotland or any other county of the UK. We focus on the services and support for the complexities of dementia. Our nurses are specialists in working with all of the many myriad of issues that can occur with the progression of dementia. We're there for families living with dementia and also for the person that has got the diagnosis. And we're also there for professionals, health and social care, who want extra support and guidance around dementia. Our support and development of services for younger people with dementia and their families has been increased over the last few years, and that is following the merger with Young Dementia UK back in 2020. We have 5 strategic aims for our charity. We launched our charity on the 1st of April 2020. Probably not the best of times to launch a new strategy because we were just in the start of our first COVID lockdown. We decided to go ahead. We did accept that there might be a problem achieving the goals that we actually set ourselves for the first year, but actually when it all came down to it, we actually did much better than we anticipated. So at the beginning of 2020 strategy, we had 300 Admiral nurses, and we've been able to increase that number to date to 378 Admiral nurses in post. And that number is growing all of the time. There's not a month goes by without seeing that number actually rise month by month. The other aspect we wanted to do within Strategic Aim 1 was to develop dementia at work and the digital pathway support, either through Admiral Nurse clinics, the helpline, on our website, through leaflets, videos, and more work in development. We're planning to put more time and effort and money into developing this further. We've also increased the number of Admiral nurses in the clinics and the helpline. We started with clinics last year, and initially we had 2 days of clinics. They were extended to 3, and now we've extended to 5 days per week. And the same with the helpline. We were working 5 days a week initially when we first started up the helpline, pre the strategy, but we're now 7-day-a-week service, and the only day we're closed is the 25th of December. It's really important to us that the Admiral nurses are recognised for the specialist expertise they have, and in order to do that we need to develop our Admiral nurses. And we've over the time of COVID, we've managed to bring forward what we were doing with our Admiral Nurse Academy. And we're really pleased with the delivery that we're able to do via the Academy and via Blackboard. We also like to collect and disseminate evidence of effectiveness to increase the number of Admiral nurses, both locally and also nationally. Commissioners frequently want evidence of effectiveness. How much does the service cost and how much does it save us? And we're able to give that sort of information because of the work we're doing within our evaluation and our insights and evaluation team. Strategic Aim 1 is relatively new for us. We wanted to seek out opportunities, not only for disseminating what we do through articles, through publications, through books, on our website, social media, etc., but also we want to do that nationally. So we have actively contribute to national policy. We're still waiting for the national dementia policy to be released, but we put in our expertise, particularly around the areas of post-diagnostic support. The development of a campaign's policy and public affairs strategy is important to us. And we had a campaign recently on continuing healthcare funding, because that is a specific problem that families are facing, hearing about it, but also applying for it and getting a successful outcome from the CHC funding arrangement, even though it is most definitely needed in the cases that they're putting forward. So we've been working on the campaign to make it much more visible for carers and families living with dementia, but also we've been working with CHC assessors and with the guidance to make sure that it is recognised that there are specific needs that people with dementia and their families have that would enable them to actually get CHC funding. One of the positives that came out of the pandemic was that we were able to set up One Dementia Voice back in July 2020. And that consists of 9 organisations who are all working together to ensure that people's needs relating to dementia are met effectively. And what we've been able to do within One Dementia Voice is to encourage ourselves to look at our USPs, to make sure we're not duplicating things, to make sure that we're working together rather than against each other. And the 9 people that are involved, or 9 organisations that are involved with One Dementia Voice, are Alzheimer's Society, Alzheimer's Research UK, Young Dementia Network, Lewy Body Society, Rare Dementia Support, John's Campaign, Tide, Innovations in Dementia, and ourselves, Dementia UK. We also have Strategic Aims 3, 4 and 5. And although I've put them all onto one slide, they are just as important as Strategic Aims 1 and 2. But Strategic Aims 3 and 4, this is about being the employer of choice. This is about being a charity that people want to work with and love to work with. Strategic Aim 4 is about making sure we have the infrastructure in place to enable us to develop Admiral nursing services and support that is so needed by families living with the effects of dementia. With Strategic Aim 5, it's about delivering the income. We get all of our money through donations. We don't get any money coming through from the government per se for the charity. So therefore it's important to us that the money that's given by the people that want to donate to the charity is used for the services and support that we need for Admiral nursing and to grow Admiral nursing. So we've been able to collect 3.5 million that we've been able to put into developing services and support for families living with dementia via our Admiral nurses. And we've been able to do that strategically so that the counties that don't have Admiral nursing support locally are able to going forward. So our progress so far. As I said, we've got 378 Admiral nurses at the moment. Those numbers are increasing all of the time. Our helpline and clinics have been increased. We have 3.5 million that we've managed to put into our new nurse fund. So we partially fund Admiral nursing posts strategically. Our Admiral Nurse Academy is growing and nationally it's getting a reputation. Very, very positive work. We've been working with NHS England and we've been talking about how people can access our Admiral Nurse Academy going forward. We also have an Admiral Nurse Development Programme. We've placed £1 million of development monies in that so we can develop the Admiral nurses of the future for those areas where we need to get Admiral nurses on the ground, but we don't necessarily have the nurses that are able to go straight into an Admiral nurse post without some support and development. As I mentioned previously, we merged with Young Dementia UK in 2020 and it's been a very successful merger and it's enabled us to develop services and support for families living with young onset dementia throughout the UK. Our campaigning and policy work is continuing. We concentrate on the things that make a difference to families facing the complexities of dementia. We don't replicate what's happening within other charities, because it's not the best use of resources. We conduct evaluations, we are involved in research, and our numbers of publications are increasing. Last year there was over 40 articles produced by Dementia UK. So we're getting more of a voice and recognised more as a specialist in dementia care. So what happens beyond 2025? The search for prevention, delay and cure continues and money is being invested into that and it's as it should be. But we also need to focus on care. There's been less money put into care and post-diagnostic interventions, and partly that might be because it's less measurable, partly it might be because it's more costly, and I think it's very difficult when you've got quantitative measures to actually prove the benefit of post-diagnostic support to the scale that you would need to do. But that doesn't stop us trying. The health and social care landscape is changing and it's ever changing, and you could argue it needs to change. The commissioning arrangements are changing. We've got different people that we need to speak to, different boards we need to speak to, different groups we need to speak to, but we keep on top of that and we will working incredibly hard to make sure that we're able to commission as many Admiral nurse posts as we possibly can across the UK so that we can help those families living with complexities of dementia. There will be more health and social care changes on the cards. That is highly likely within the next few years, and we will keep abreast of that. As I mentioned previously, the National Dementia Strategy is being worked on at this point in time. It's now going to be a 10-year strategy rather than the 5-year strategy, and we will be feeding into that, particularly around the area of post-diagnostic support and clinical delivery. On top of that, the NHS long-term plan is being reviewed at the moment, and because of the COVID effect, some things have had to be kind of postponed or delayed, but we've been assured that there will be a section on dementia, which is well overdue. What we also want from a charity is we want people to recognise that dementia is a disability with all the attendant rights, because frequently families don't realise that. And I think that times have moved on, and I think that we need to kind of engage an awful lot more with the disability charities that are out there. The Admiral Nurse Academy is growing, as I said before, and I plan to see that that has more national influence. It will be a national academy for dementia excellence, and that's something we will develop over the next few years. I want us to be increasingly recognised as the clinical charity for specialist dementia advice and support. I think we already are, but I'd just like that to go that extra bit more. I want to be in the position where when people are saying Admiral nurses, they automatically recognise what an Admiral nurse is, much in the same way as people do from Macmillan nurses. And equally important, I want to be in the position where we have over 500 Admiral nurses, and ideally around 1,000 Admiral nurses. That will take time, but we are making good inroads into that. Thank you very much indeed for listening, and bye-bye.